It's that time of year when you know someone who is sick, you're trying to stay away from someone battling a sickness, or you are sick yourself. And right now, the flu is really going around. Brandon Palinski is with us now from Toledo-Lucas County Health Department to talk more about the recent rash of cases locally. Thanks so much for joining us today.
Yes, hi.
So,
We are
yeah, are we
seeing an
seeing a
uptick.
rise here? Yeah.
Yeah, we are seeing a little bit of an uptick. We're about 2 weeks delayed from where we typically see a spike after the holidays, and that could be as simple as a lot more cold weather in the recent forecast. People are spending more time indoors around others. Um, but otherwise, Ohio as a whole is seeing just an uptick in influenza cases and admissions to hospitals.
And is it influenza A or B or both or kind of general?
Probably a mix of both. I don't have specific the ratio of them.
But you have seen also an increase in hospitalizations too. So are we seeing serious illness?
So flu is reportable in Ohio only for those who are admitted to the hospital. Typically, if you just go to the urgent care, get diagnosed with flu, but you're not ill enough to go to the hospital, we wouldn't receive that report. So all of our reported data is for the hospitalized cases, and that does mean that people are getting sick enough to actually seek that care.
Yeah, I've been hearing about it, with families all over. Oh, so-and-so got it. Okay, now the sibling got it. Now I've got it. It really seems to be making its way, taking out families. But you said we're a little bit delayed of where we usually are. But do we think we've hit the peak of it or not quite yet?
I think it probably depends on how much more weather we get that keeps people indoors, keeps them in close proximity. Um, Depends on how well people are washing their hands, are making sure that if they are sick, they're staying home, not going out as much as they can. All of those factors combined, we may be plateauing, but it's possible that if we continue with a large cold spike and for another couple weeks, that we might still see some rise.
Yeah, I do think we have a pretty cold forecast in the coming weeks. So yeah, talk a little bit more about what we can all be doing to help stop that spread.
So absolutely. So one of the big things is if you're feeling ill, try to stay home if you can. Stay away from work, going to congregated places. Wash your hands frequently. Make sure that you're masking up if you can. If you're actively experiencing symptoms, and just do your best to minimize when you are symptomatic being out around others. If you have a fever, wait till that comes down without medication, um, and really just practice those simple hygiene.
What about the flu shot? Do we know how effective it has been this season?
I do not have that information at hand. No, I'm sorry.
Is it too late to get a flu shot at this point if somebody was like, well, we're already most of the way through the season?
Absolutely not. We still offer the flu shot, especially for those who might be immunocompromised or you're going to be spending time around someone who maybe has a weakened immune system. We would definitely still recommend considering a flu shot.
I feel like we used to just talk about COVID, COVID, COVID all the time. This year, it does seem to be that I'm hearing a little bit more about the flu. Is COVID still very active, or is it something that we still need to be concerned about, or is it really starting to ease?
COVID's definitely still out there. It is trending downward compared to flu and other common cold viruses that might be circulating. But we still definitely see a number of cases that are pretty steady.
And, just to wrap it up for families here, at what point should a family, a parent or somebody say, okay, it's time to go to the doctor to do something about this, or maybe it's okay to just stay home?
Um, I mean, if you don't have a known allergy to something, you're starting to get those symptoms and you're not feeling well, it might be worth asking your doctor if they feel you should get tested. If you're really feeling bad, down and out, definitely talk to your doctor, talk to the urgent care, and um, stay around your family or as minimal people as you can.
Yeah, try to keep that from spreading to more families and households. And again, as you mentioned, if it stays cold, that risk tends to stay up there. So we all need to do what we can, wash our hands, close ourselves off if we can, and we'll all just get through this eventually. It'll warm up eventually, right?
We certainly hope so.
All right. Thank you so much for your time today. We appreciate it.